Hey guys, welcome to Nine Lives Energy. My name is Chrissy Smith, and together we energize your body from the inside out. Thank you so much for joining us today. We have Carlos Bonilla today. Did I say that right?
Yes, you did.
Thank you. And I have seen him several times at Healing Hands Chiropractic. I used to go see Damian Rodolfo. Him and I traded out for about 12 or 13 years and had an old injury resurface. And lucky me, Carlos knew how to use the piezo treatment on my foot and was able to snap things back into place for me. So we are going to be interviewing him today, and he's going to tell us all the wonderful things that you can do to help patients recover and get back to all their athleticism and their sports and just being able to enjoy life. So tell us how you got into this field of study, Carlos.
It was not planned. I can tell you that. I did all my undergrad and everything back in Puerto Rico, but in my head, I wanted to be a medical doctor. Since the beginning, I was a child. Everybody came to me and said, "You're gonna be a doctor. You're gonna be a doctor," and that's what I just made in my mind. I'm gonna be a doctor, but the only field that I knew was medical doctor. So I did my undergrad biology, Inter-American University in Puerto Rico. And from there, I moved to the U.S., specifically to Florida. I was going to go to med school in UCF, uh, University of Central Florida, down there in Central Florida. But then by then, I was married. I have a child, so life has a different pathway for me. I need to go back to work just to provide for the family, and the medical doctor passed on the background. But I always had the love for the medical field, for all these healthcare. So I decided to start from the bottom. I did a couple of security jobs. I did EMT, hoping to go medic school, from paramedic, become a PA, from PA, and do all that protocol. And I became a firefighter EMT engineer. From there, everything started. I remember one day we were in a call. I was in a rescue. We went to a traffic accident, and the patient, he was supposed to be transported. He needed to be transported. And I remember the patient, he said, "No, I don't want to be transported. I go to my chiropractor. He fixed me up." So that was the first time I usually heard the profession chiropractor like fix you up. I was like, what was that? I went back to the fire station. I Googled it. Caught my attention. Next time, next shift, again, the same situation happened uh, with the prior crew that they responded to, and the patient was a chiropractor. And for me, it was like a signal. So I went back, did my homework, looked for schools. I already have my prereqs because of the biology, and that's when I ended in the chiropractic field. It was meant for me. I love it. I don't imagine my day without thinking as a chiropractor.
hmm So, how long were you an EMT or paramedic or firefighter? Was it kind of a combo thing where you were a
Ye-
paramedic on the truck?
Yes, because in Florida, you need to be an EMT. Is the lowest that you can be an EMT before you go to firefighter school. So you're basically an EMT firefighter. And then while you are in the service already, when you're a fireman, then you start getting all these other classes that made you engineer or a tower rider, or you can go for officer as a lieutenant, and you start working yourself up. I was there for about 4 years doing that profession.
Now, how long did it take you to complete chiropractic school? Because you had, I guess, a lot of credentials already or the
Hmm.
prerequisites because of being a biology major.
Yes. So basically, for chiropractic, you need to have an undergrad in health science. A lot of people go with applied kinesiology or something related with sports. In my case, I had the biology field, and then it every school is different. There's a lot of different schools out there. Palmer, I went to Palmer College of Chiropractic.
hmm
There is always school in New York. There is Lives University. There's National, Logan. There's a lot of schools. Every school, it's different, but we all average between 3 to 4 years. In Palmer College, I was able to do it with 3 years and 3 months.
Were you working at the same time as well?
And no, no, usually it's hard to work because you're a full time student. You're there from 8 o'clock to 4:30, 5 p.m. If you are able to work, you can have part times if you work overnight or at night, but by then your brain needs rest and you need study time. So
Yeah.
it's really hard to just to keep a job and then go and go to school as well. But being a grad program, the financial assistant, financial aids works different in where they provide you that assistant. You have work study on campus, or you have other financial aids. You can apply for scholarships, uh, and that's how I was able to go through school. And I have by then I had my wife and 3 kids.
Oh my gosh. Well,
Mm-hmm.
where there's a will, there's a way. Was your
Yeah.
wife working at the same time as you
No,
were going to
no.
school?
No, no. She was at home with
Wow.
that. I when I first started my first trimester, because by then we were doing trimesters. She got birth to my last child, my daughter Lila, and then she was not working. We were all making it with my student loans, and here and there I went outside, did some DoorDash too, just to try to keep up on everything. But it was possible. Nothing is impossible in life.
That's right. Where there's a will, there's a way. And if you want something bad enough, I really truly believe that the doors will open up for you for those opportunities to present themselves so you can be in more alignment of where you're supposed to be going and what your dreams are. So, how did you get up to North Carolina? How did you come to work with Damien?
A funny fact: when I first moved from Puerto Rico to the States, I moved to Wisconsin. It took off for me. Coming from Puerto Rico, Wisconsin was a big change. Then I moved down to Florida, too hot. So I wanted something in between. Okay,
Mhm.
and also I want a place. I wanted a place in where the chiropractic profession will be growing, and that's what's happening right now here in North Carolina, because it opens the doors for more opportunity. So after, with my background in track and field and all that, I was looking for a state that gave me the opportunity to grow. And then through the school, they gave you also have a list of providers that are able to allow shadowing, because by the end of your clinical, you're allowed to go to the field and do some work in the field as well. So that's how I did my last 3 months of my chiropractic school. I was doing my homework. I followed him. I had an interview with him, see what they were up to here, and I came here, did my 3 months of my internship, and I stayed around.
Yeah, because Damien says you're not going.
He said, "You are not going." So I was here. It's funny. I was here. My whole family was in Florida, and I was traveling on weekends to Florida because my athletes were used to compete on Saturdays. So
Oh my God. What kind of athletes?
I had 100, 200, and hurdles. So it was really challenging because two of my athletes qualified for state championship in Florida for middle schoolers. So it was challenging for me just to do training. Sometimes they were recording, or we would just do this to see what was going on, and
Mhm.
then traveling there on weekends for track meets.
Oh my gosh.
Yep.
That is so awesome. Did you play any sports when you were in high school or college?
I did volleyball for about 8 years, and
Okay.
then I did track and field for about 10.
Awesome. What was your favorite event in track
I,
and field?
I did hurdles 100 and 200.
Awesome.
Sprints, don't get me more than a mile to warm up a little bit, and that's it. I hated it.
So you're not going to be running the 100-mile races like Damien?
Nope, you're not gonna see me.
Losing toenails.
I can no, I can hand you the water. I can help you with that. Yes, but no.
Well, tell us what certifications that you have right now, and how your licensure. How long does it take for it to expire? How many
Hmm.
CECs or continuing education credits do you need every few years? How does that work?
Okay, so from school you have a lot of training. Different again, different schools specialize in different techniques. Okay, coming from Palmer, we do what we call Palmer package, in where they teach you Thompson, Gunstead, Diversify. You can do upper cervical. So it's different techniques, different ways of provide the adjustments. You graduate from chiropractic school. You can do. In my case, I'm Rocktech certified. I'm chiropractor. I'm working into my ART courses right now. Structural movement, functional assessment, which is called SFMA. Uh, so you keep growing after
Mhm.
you go for your chiropractic. And what helps is that after you're a chiropractor, right, you have to recertify every year. So, and in order for you to do that, you need to have 18 hours from where 10 hours are going to be live. So those are continuing education hours, have to be live. And then the rest 8 hours can be online. So that keeps you up to date and making sure you're constantly, this is a field that it's constantly changing. We're growing, we're new out there, and research is showing that there is different ways that can provide improvement and can provide benefits to the patients. So that's the part of the certification, and that's what we do every year. And then from my part, it's that's what we are. Usually chiropractic. I want to go and specialize in sports chiropractic. That does not mean that I'm just gonna see athletes. It's like here we see family, we see kids, we see
Mhm.
pediatrics, but that's what I want to start leading to, and then we go from there.
So you're still working with athletes now. Are you
Mm-hmm.
you're at A&T right now?
Yes, so I work on Thursdays. I'm over there with the A&T athletes, Go Aggies there. I go there on Thursday, but they can also come here on weekends. Right now, we have from the NBA G League, the Greensboro Swarm. We
Okay.
are there we're there with them on the locker rooms when they have home game days. And now we're gonna start with the arena football team, professional arena football team with the Carolina Cobras, which is about to start now by the beginning of March, and then the same thing, home games. Work with them on the locker rooms. With I'm in North Carolina A&T. Dr. Rudolfo, he is with UNCG,
Uh-huh.
and where he goes on Tuesdays, like mornings. That's where he's at. And Dr. Matt, it's with Greensboro College.
Oh, wow.
So yeah, with all of us, we just go and try to go to the college and provide our services to their athletes.
That is so cool. Well, are you seeing certain, I guess, uh, injuries, exercise injuries, maybe sports injuries that you used to not see? Or you can also take this question in a different way. I
Mm-hmm.
asked another professional recently, are you seeing any type of societal changes that are making human beings move differently? For instance, text neck, or, what kind of
Yep.
things are you seeing and how are you addressing those issues with the patients?
Yes. So really good questions. Uh, with athletes, that's what I love about the profession. That with athletes, based on the sport that you do, it's going to be the amount of injuries that you're going to see.
Hmm.
But what we're doing, what we're seeing right there, right now in the society, it's that texting. It's affecting the posture of the human being at the point in where the cervical lordosis is being lost,
Hmm.
meaning that now we don't have a lordosis in our cervical curvature. We start having more stacking, which is going to affect neck pain, upper back pain, which is going to lead to degeneration of the discs at an earlier stage of life, and that's bringing a lot of problems. We're seeing a lot of neuropathies, going down hands, tingling sensation, numbness on fingers. When we do X-rays, we start seeing all that stacking going into the cervical. And when we ask patients, it's like, "What do you do?" I work all my day sitting in front of a computer with
Mm.
phones. So it's more about patient education, trying to reinforce, take breaks, go out there, do these stretches, do these exercises to keep that health. Uh, and that posture when we're in the place that he's supposed to be. But that's the one that we're seeing a lot nowadays.
Are you also seeing the athletes that you see at the colleges, because of the texting, and maybe if they're having to put a helmet on also, and it's even
Mm-hmm.
more weight that's going forward like that?
Mm-hmm. We see that a lot with in the case with the helmets with the football players.
Hmm.
A lot of upper and low back problems. It's the most that we see. It's basically with posture, pelvic hinge, poor core stability, and it's all also related to this change of posture that
Hmm.
we are doing every day.
And, one of the first things that guys want to do, is let me do some bench
Let me
press,
do some bench. Let me squat. Let me
and that
squat.
bench press is probably making the issue that much worse. It's like, why don't we roll those shoulders back
Mm-hmm.
first? Let's do some pull-ups.
Yeah, it's like you see big pegs, shoulders forward like this, and then they say my neck and my back hurt. I wonder why. Let's
Yeah.
just start bringing you there, those shoulders down. The same thing with the squats. We're
Mhm.
having this pattern in where we said you have to keep your back straight. Okay, let's stop right there. Having the back straight do not means hyperextend your low back curve. That
Mhm.
lordosis, it does not mean doing all this. No, it means that you have to engage your core, have a proper ascended pelvis hinge for you to be able to go all the way down. So those are the first one that the ones that we see the most. It's like also with poor movement patterns, they hyperextend and trying to go all the way out. They say, I feel it in the front of my thighs that it don't leg me. Well, you have
Mhm.
super tight hip flexors, psoas, and it's because of that poor hinge and technique and the functional movement.
I got certified in the functional movement screen as well. And guys, we've already had a test on this already, and it's a 7-part series. So I'm sure that you
Mm-hmm.
remember that from our last module that we did. So this is actually putting some of those modalities into practice. You will see some of these things, whether you're a physical therapist or a chiropractor or a personal trainer, an athletic trainer. It's a wonderful tool that assesses what someone's movement pattern is, and it
Yeah.
can also be used to identify where somebody might become injured as well. The NFL even uses it too.
Yes. Yes. It's basically a good preventive method that we all providers use for assess movement. If you have a poor pattern with your movement, you are more propense to have injuries in the field. It
Mm-hmm.
is what it is. Okay, so it's a matter of how can we address it? How can we make your body more, or you as an athlete, more aware of what's going on, and how can we guide you to fix those problems?
Yeah. Well, what are some of the pros and the cons of the job? It seems like one of the cons, as much as you are doing, it does not leave a whole lot of personal time or family time. So
Yeah.
that might be what con.
Yes. That's a con. But a pro, it's that you don't it if you're gonna once you're in the field you realize that it's not, how can I say it? It's not, you're not working, you are doing something that you're passionate about. And
Mm-hmm.
the good thing about this is that you can involve your family as well if you want to. As an example, you want to open a practice, you can set your whole schedule, you can see a family can be part of the practice if you want to, and that opened the door for more family time. In my case, I'm new here, I'm just all about let's get it done. You acquire a lot of experience with athletes, uh, which it will open you doors big time. And right now, thanks, once working here, I have had the opportunity to work with Olympic athletes. One of them competing now, being ready for the Olympics, Daniel Roberts, in the 110 hurdles, being able to see as athletes that are already Division 1 having scholarship with Georgia, with Alabama, from here, from our own Greensboro. So that's basically the pro of all this that you do.
I'm sure another pro would be to use some of these awesome modalities. Tell us a little bit about the cryo chamber, the acupuncture that you have there, the infrared sauna. Tell us a little bit about
Okay.
those things.
So, a little bit of our modalities. We have deep tissue laser therapy. Okay, deep tissue laser therapy. A lot of people thinks the heat is what's it's the therapy, but it's what's basically what's happening at the cellular level. Okay, so with the deep tissue laser, we just go and penetrate deep into the tissue, promoting healing, decreasing inflammation, increasing blood flow without the inflammation, saying it without having the inflammation response within the tissue, if that makes sense.
Mm-hmm.
That's with the deep tissue. We have the piezo, which is a shockwave therapy. Okay, so I like to visualize this one's like if you're in a traffic congestion, right? And you have the fire truck coming. So as soon you hear the siren, which is the sound waves, everything else open and all the congestion breaks. So it's the same way with this sound wave. It basically goes within the tissue and it start breaking any scar adhesions, any adhesion, any scar tissue that you might have that is preventing that joint or those tissues to move freely independently. Cryotherapy, we have the chamber in where you completely go, your whole body is it's in it. It goes, that one is systemic. And the brain, it start decreasing the levels of cortisol, which is a stress hormone, and increasing levels of dopamines, improve mood, improve the sleeping. It's amazing. It's cool.
Well, I was stressed out in there, so I don't know if that works.
It's
I
cold.
was
I'm
like,
not gonna.
let's hurry up and be over with.
You have to be ready for that one. This morning, I got my son jump into it, and he tried the extreme, and he was like, "Yeah, I'm not gonna do that one again. I just stay with a little bit less cold." But afterwards, it feels really good because he worked out really hard yesterday. So they started seeing that decrease in inflammation systemically, and they start feeling well. A lot of athletes come here either prior or after events, after athletic events, just to jump into the cryo. The other one that we have is the compression boots. Compression boots, basically, we have legs, we have hips, and we have arms. Basically, it's going to be like a boot, right? That is going to start filling up with air, and it's going to start pushing blood flow away from the legs up to the more center, and then it's going to start releasing the air, which is you're going to feel all the new blood going back into the legs. A lot of athletes with that they're sore because they start building up lactic acid. That's a good way to start flushing all that out. Diabetic patients that had swollen legs and everything like that, that's a good way that we can just start getting that fluid and everything moving back and forth, reestablishing the good flow on the legs. We have infrared saunas in each of the on the locker rooms that we have here. Acupuncture works different. Acupuncture, we have two acupuncturists here. Acupuncture, I said, it's targeting the muscle on the tissue within the inside. Okay, most of the other modalities that we have, we're targeting from the outside. With the needling, we just go straight inside and start releasing the tension on those muscles. It works. It works really good. What else? What am I missing?
You guys have the IVs, don't you? Because I
Uh,
saw what's her name's face down there, Misty.
Misty.
Yep.
So yeah, we have Misty is our nurse practitioner here. She works with IVs, IV infusion, regular saline. They do vitamins. They do. I forgot the one that makes you feel a little bit sick at the moment, but then you feel like a superhero. She offers different type of IVs based on what you want to accomplish. She also can do functional medicine in where she sends you out to do a full blood panel and hormonal and see how your body eats, whatever you are deficiency on. She provides you supplements and just guides you through the right way.
Yeah, these are all the things that they have, guys. So you have the chiropractic there, the
Mm-hmm.
InBody scale. Did we touch on this one yet? The InBody scale?
So it's a scale. Basically, you step on it and it measures your BMI, your fat percentage, your body weight, how much in that is fat, how much in that is water, how much of
Uh-huh.
that is bone, muscle. And then it
Okay.
gives you basically, yeah, an average in where you have to improve, what you have to do to lose weight.
And here's that piezo machine,
That's the
guys.
piezo.
Yeah, it's good.
It's
And you can
good.
all you can tell them to turn the heat or turn it down just a little bit.
Yeah, that one.
Depending on who you have
Yeah.
administering the modality. So tell any of our students that we have maybe some advice that you wish somebody had given you before, or just advice that maybe you would want to share with others now that you know after being in the
Mm-hmm.
chiropractic field for a little while.
Eh, Open your eyes. Okay. Open your eyes. Do not. How do I say it? when I was a kid, everybody told me you're going to be a doctor, but what type of doctor?
Yeah.
Okay. Go with what you believe and not be what you have been told. I wanted to be a medical doctor, but do I really, in my case, and this is respectfully, this is the way I see it. Do I want to disguise the effect with medications, or do I want to treat the cause in a natural way and fix those problems? So that's what I mean. Keep your eyes open. Go with what you believe. Okay. At the end of the day, you're a medical doctor, you're a chiropractor, you're a physical therapist, you're an athletic trainer. We are here for the commonwealth of our patients. They are the one that comes first. Okay. And please, let's just work within a network to each other just for the benefits of our patients.
If there's any student that is looking to maybe get some hours and just shadow you or shadow anybody in the Healing Hands
Mm-hmm.
office, is that available to our students? Not like a full on internship, but just a few hours just to see,
Yeah.
hey, this is what I want to do. I saw uh, Dr. Bonilla do this, and I want to do it too.
Yes. Yeah, that of course. With that, they can call the office. The number down on the
Yep,
screen. They can
just scrolling
communicate
at the
with.
bottom.
They can also hear our manager of operations, Diane Creech. Can help them with that. But of course, if you just want to pass by and say, "Listen, I just want to see what's happening in here," we can plan and we can get you. I want you here in a busy day. I don't want you here in a slow day, which is it's hard to have a slow day, but the really busy days is when you can see our athletic trainers doing their job while we are adjusting, we're referring to a PT, or we're having, hey, this patient is chronic. I need some needles here right now just to get this pain down. So that way you can see how we rock and roll in here at the office.
Give me one success story from a patient that you've had, somebody that maybe has stuck out in your mind and you're
Mm-hmm.
like, they attribute their health and their wellness or their ability to move better without pain to you. Tell us this story.
Eh, oh wow. Let me
I know I
that's
threw this one on you.
I wasn't expecting this one. But let's go from a patient. I remember this patient, and it's not even sport related. This one, an elderly patient, that she was complaining back pain and she was having problems of high blood pressure. Okay, so this one's when we go back into the books, high blood pressure is directly related with thoracic.
Yeah.
Okay, specifically, we can go into those segments from T4 all the way T10, which are the nerve that goes and innervate those organs. Okay, but the back pain was the same, and then this is scary because we have back pain and you have high blood pressure. It's like what's going on in
Yeah.
here? Okay,
What's going on with your heart?
so after we clear everything, we clear the room, everything is good. We start treating these patients for neck and back. Why neck if she's coming because of back pain? Eh, we're coming at the same thing. In this field, we go with do not follow pain. Okay, see outside of the box and see what's happening. Okay,
Mhm.
so this is what's happening. Patient had an anterior head tilt with anterior shoulder rotation, right? Which is already sending me into this position, compressing thoracic spine. So if I'm able to open pecs, give exercises for this double chin. Ladies don't like it because it creates a double chin. We just don't care. But but we're doing chin tilts and all of that. We're going to be able to reinforce that. So that's when we started working. We did a thoracic adjustment. Just by fixing this posture, doing the thoracic adjustment, we were able to download blood pressure at the point where she's not taking blood pressure medication no more, and the low back pain is being resolved.
That's
And it's
awesome.
basically let's just fix something. You're the comfort the back, but I need to get that neck back, do some adjustments in here, and get you going. So that's one of the many successful one that I have done. Coming from track and field, I have an athlete hurdler. Same thing. Not being able, and this was a short notice because she had a master's track and field meet coming soon, and she was like, "I am not able to three step." So in the track and field, when you are doing hurdles, we three step in between each hurdle. It's a technique, and that allows us to go faster. It's like out of the nowhere, I cannot three step. I look at the hips, completely rotated pelvis. Adductors gracilis in that trail leg super tight. Was able to get her into release that with some ART movements in here, myofascial release. Work a little bit on her techniques thanks to my background. Uh, she showed me the video when she did her master's. She was able to 3 steps and she placed third.
That's
So
awesome.
those are really cool things that we can do here just by see what your body is doing and what's happening around.
Just like what we did in one of our previous classes, guys, with the tennis ball stretches. Just because you have pain somewhere else doesn't mean that that's where the pain is coming from. It can be compensatory. And so
Yep.
what caused me, the pain in my back that I had was actually a tight hip flexor, a tight psoas, a tight soleus, and calf, which the whole thing was just
The whole
jacked
chain.
up. Double
whole
chain,
chain.
yeah. So no wonder I couldn't squat. No wonder I was in a lot of pain. So
Yes.
thank you so much for joining us today, guys. If you would like to go and shadow Carlos, you can find him at 916-1705 at Healing Hands Chiropractic on Longdale. And there's so many things to go and look at there. I'm sure that it would be like a playground for anybody who is looking to go into this field. Thank you so much for your time, and you have a happy day.
Bye-bye.
Bye-bye.
Thank you.